So this is a story about a jury up in San Francisco giving $289 million to a man that says he got cancer from Monsanto's Roundup weed killer. He used to work, I guess, as a school groundkeeper, and he was used this weed killer spray, very often, and now he's got a terminal non-Hodgkin's lymphoma. And as you can tell, he won, but he's pretty devastated, and I mean, I feel for him. And it's $289 million too much. How much is your life worth? If there was, I know there's many jobs in the world where people take very little money and risking their life. But if there's something that says someone says, hey, you're gonna get terminal cancer and you're going to die, how much would they have to pay you for you to say okay? So I again, there's really no happy ending here. But I do believe that I do believe in responsibility. This man made a decision to be a groundkeeper, and he's paying the ultimate price. And the company, I think, we could argue that maybe I think they should be put on trial for murder. I mean, again, this is all assuming that, it all depends on how firmly we believe this weed killer caused this man's cancer. But if in fact it is the case, I believe that you have to, you have to give the proper punishment to discourage everyone else. And again, this goes into the talk of how I think the world is a little different. Is not set up correctly. The financial system, it's just not set up correctly. That we have to set the proper incentive in place for people to do the right things. But anyway, so I took a look at some of the famous celebrities who die of cancer. And here's a lot of these I didn't even know. Patrick Swayze died in 2009 of pancreatic cancer. Again, that's a cancer of the pancreas, which sits in the back of your abdomen. And those are very deadly cancers. They get discovered very late. But anyway, he died, and he was, Ghost, the actor on Ghost. Paul Newman died in 2008 of lung cancer, and lung cancers, very related to smoking, as we all know. Peter Jennings in 2005 also died of lung cancer, and he started out saying he's gonna start chemo. Again, chemotherapy, a lot of times for these, localized cancer, is that when it's basically an indication that it's spread out to other areas, and so that's a bad sign if you start out treating lung cancer with chemotherapy. Farrah Fawcett, Charlie's Angel, also really famous, died in 2009 of anal cancer. Cancer that's associated, with a viral human papilloma virus. Here's another, Ted Kennedy died. They initially said he died of stroke, but he actually died of brain tumor. Michael Crichton, Jurassic Park, died of lymphoma, and also throat cancer, lymphoma. But anyway, Sidney Pollack died in 2008 of stomach cancer. Tony Snow died of colon cancer after suffering from ulcerative colitis. Again, ulcerative colitis is chronic inflammation of the colon, and they have a high chance of getting colon cancer. William Rehnquist, the Supreme Court Justice, died of, thyroid cancer. But anyway, I'm gonna stop here. It's pretty depressing. A lot of well-known, they're basically celebrities. They're people too. They're not immune to cancer. So let's talk about what are some of the most common cancers. Here I pull up a pie chart. Again, you're gonna find different charts, and they might show different things, but this is just one of them. It says for men, prostate cancer is most common, then lung cancer. Then you get into melanoma, which is one type of skin cancer, and then non-Hodgkin's lymphoma, minority, all the way down to liver and bowel duct cancer, leukemia. And in female, it's a little different. They have a lot of breast tissue, and they're more prone to breast cancer. Lung cancer, second, colon cancer, thyroid, all the way down to melanoma, which is one type of skin cancer, all the way, very little is pancreatic cancer. Again, pancreatic cancer, although relatively rare, it's, very extremely deadly. So what exactly is cancer? Let's see, let's go up to here. So cancer, well, let's talk about the counterpart of cancer. Is basically a tumor, benign tumor. And tumor are basically a group of cells that sort of grows and grows and grows, but they're not able to really spread out to other part of the body. Cancer is different in that this abnormal growth actually have the ability to, get into other part of the body, whether it's through local invasion, aggressively spread out to the neighboring area, or actually spread out to a little further area through the lymph node, or spread out through your whole body, even to the skeletons, via your blood vessel. So there are different type of cancer who are prone to different type of spread, and the let's see, sorry. So what in general, the theory in cancer is that you want to, one, prevent it, do things that to prevent cancer, but number two, you want to discover it earlier. So how do cancer present themselves? What type of symptoms can they cause? Again, this growth usually can present as a lump somewhere. If it's outside, it's easier to diagnose and treat, but some of these lumps are inside your body. And so they don't really cause you're not very visible until they cause symptoms, right? Now, other things on the skin other than lump is you could see molds that changes in size, shape, color on the skin. Again, inside your body, again, with this growth, it could cause symptoms such as if it's in the lungs or windpipe, you could have cough, you could have voice changes if it's by the vocal cord. If it's in that GI system, you could have change of bowel habit. When you may cause diarrhea or constipation. If it's in the esophagus, you may have difficulty swallowing food. And anywhere in your the other thing is it cause abnormal bleeding. So whether it's in the vagina, so not correlated with the menstrual period. Or bleeding in the stool, if it's a lesion in your GI system, it could cause bleeding in when you make a bowel movement. The other thing is you could also see blood in the urine if there's a cancer within the urinary tract. Again, these are not the only cancer is not the only reason to cause bleeding, but it's it's one of the possibilities. The other thing is sore or ulcers. If your mouth or your skin somewhere develop a sore or ulcer, actually also inside your GI system you can have ulcer, but again, those are not visible. Again, non-painful ulcers with an underlying growing mass, that's more concerning. Ulcers, that's a little painful and they sort of go away within generally 2 weeks, then they're most likely inflammatory, and they're not probably not cancer. The other thing is difficulty passing urine. If there's a tumor within the urinary tract, you might have difficulty passing urine. Weight loss. This tumor growth may obstruct your GI system. The other thing is it also requires a lot of nutrition, so you may have weight loss. Unexplained pain. Pain in the deep, constant pain in the joints. Or just pain in various areas where there's cancer. unexplained tiredness and fatigue. Again, this could be depression or other things, but that's also a possible presentation of cancer. Also, unexplained night sweat. Sometimes this has to do with cancer of your blood system, blood and vascular system, blood cells. Also, abdominal pain. Some cancer in the belly causes obstruction that could present as pain. So these are things that you could go to your doctor and sort of, talk to them about, and they could do appropriate workup. Now, doctors are very busy and they see so many patients, and there's also so many symptoms that are sort of overlapping. So sometimes if you really think you do have something, especially if you have family history of early cancer, then you should take the initiative. I mean, it is your body, it is your health, and you should take the initiative. Now, the cancer causes, because the next thing we want to do other than early diagnosis, we want to do some things to prevent cancer. Now, this is the one of the pie chart I pulled up about the cause of cancer, and one of them significantly is the diet, the things that we eat. Next is smoking, and then sunlight exposure for all the skin cancers. And so majority of these are preventable. I mean, a small portion of this is genetic, although I believe genetic is pretty important. I've known people with a lot of family members with cancer, and then they live relatively healthy and they get cancer. So and I know the other way where they seem to do a lot of things that's bad, but then they never get cancer. So but especially if you have genetic predisposition to cancer, you really should be careful about your diet and tobacco and all these things that are potentially preventable. So let's go to a graph. Actually, let's go see what Harvard and maybe even Mayo Clinic, what they have in common of saying what you can do to prevent cancer. Here's Harvard. It says, let's go down the list. Okay, avoid smoking. Avoid actually tobacco in any form, even secondhand smoke and oral chewing tobacco. There's a lot of toxins and chemical, we all know, and it's about a matter of you just need to again, this is a whole separate thing of quitting smoking. Okay, now why do they allow to sell tobacco? I don't know. And the other second is eat properly. It's clear that they said consumption of saturated fat and red meat increase your risk of cancer. And the other things about fruit and vegetables, in general, I mean, they mention grapes, red grapes, even mentioned turmeric, and also other things. But in general, I believe that grains, vegetables, and fruits is important. And fried, very char food, those are most likely more risky food to eat. The other thing is exercise has known to reduce risk of cancer. I think in general, when you exercise, your heart work harder and your lung work harder, and your whole blood vessel gets dilated, and in general, your body just gets healthier. So exercise in general is just help you in general. I mean, people feel better after they exercise with proper exercise. So I think it definitely will benefit if you want to avoid cancer. The other thing is staying lean. Obesity, actually increase the risk of many type of cancers. So it's important to control your weight and stay lean. Again, all these are easier said than done. But again, if you look at all the bad things of cancer, and as these days, we all see more and more people getting diagnosed with cancer, and some we see firsthand of how painful of a death it is. And so that's something that, you just have to put that in the forefront of your mind and get motivated to do all these things. Again, I'm not perfect. I mean, there's, we're all busy professionals, and a lot of times I'm not as disciplined as I should be. And then number 5 here says, limited drinking, alcohol, liver cancer, etc. I mean, you really don't. I don't drink much at all. I only drink maybe occasionally when people have birthdays, and it's very little. The other thing is radiation. There's the sun exposure. I mean, everyone when they're young they want a nice tan, but the sun is definitely related to skin cancer. And especially if you're born with a very white skin with not a lot of protective pigmentations, then you should definitely try to use heavy sunscreen and avoid the sun to avoid skin cancer. The other thing is environmental toxins and industrial toxins, and that's the case for this man. He was exposed to a weed killer, and again, those can predispose you to cancer. The other things, vitamins, vitamin D. I believe the diet that we have sometimes is just not very balanced, and that's a reality. And so I believe in vitamins because I think your body again, they're vital nutrient, and that's why they're called vitamins. And your body, with its immune system and cancer fighting system, needs the proper vitamins and nutrient to fight it, to control it. And Mayo Clinic essentially says similar things. Eat plenty of fruit or vegetable, avoid obesity, and avoid the sun. So again, it's a awful story either way. I mean, whether this person gets $289 million or not, I don't know. I mean, they're probably gonna appeal this and settle a lower number. But anyway, we wish him and his family well. And again, this is a story on cancer and corporate responsibility. Thank you.